Good afternoon, everybody. This is Dr. Chris Ebert Santos with Ebert Family Clinic's weekly COVID update specific to Colorado and the mountains. Today, I had a talk with the emergency room doctor on his way into work, and he unfortunately said that they had a bunch more cases this week, all between the ages of 20 and 55, several who worked in a popular pizza restaurant in Breckenridge. No one in our community can let up on the precautions. And I think you are doing a good job. The people that I see on the street, on the bike path, in my office, even the kids are faithfully wearing their masks. And I know they're washing hands and social distancing. Now, everyone else is thinking about what's coming up, what's going to happen with school. In our meeting last night with the Children's Hospital experts, including 3 infectious disease specialists, they discussed again what might happen in the fall. And as I said last week, 7 different organizations are working on it on a national level, and many are working on a local level. What I would hope is that we will have a reliable antibody test, which we don't have now, and a better idea of what those antibodies mean as far as protection. That would help us to understand who has already been infected and has less susceptibility to the disease. Meanwhile, I think some of the options would be to have reduced classroom size. That could mean splitting the day. That could mean half of the students electing to continue working from home with the support of the teachers and the school staff. And there are other ideas that every other day classes, things like that. That's similar to what we talked about in daycare last week, where they're having half-day daycare with a reduced class size for now, and they're going to see how that goes. So the third big question that's coming up is about summer camp. Now, any organization that is open to services, whether it's a restaurant or a school or a daycare or camp, has submitted a plan of how to keep those patrons and children safe. So we can count on that they're going to have measures put in place. The other thing to consider as a parent is how desperate are you and your children to take advantage of these opportunities. I myself loved camp, and I was a camp counselor for many years, and I hate to deprive anybody of their wonderful camp experience. But there are some of us who are doing fine at home or with our family and getting outdoors and not suffering too much. And there's other families where the parents need to be out of the house at work, where the kids are really going up a wall and they don't have other opportunities. So I think each parent is going to think about their own situation, other risks such as exposure to high-risk family members such as grandparents in the home, and make those decisions individually. But definitely there are camps that are opening up. My niece is going to be a camp counselor for YMCA on the East Coast, and it is a matter of risks and benefits. And each one of us will look at that individually. Thank you for joining us today, and we will have more information on our website, on our blog, highaltitudehealth.com, and in our weekly Facebook video.